Number 4, we're going to talk about kidney pericardium. I showed it as KP Yang-Ming pattern, how to treat reflux, acid reflux. Number 5, tie-in Yang-Ming pattern to treat reflux. Number 6, I'm going to share with you, we're going to discuss a bit of ACC patient and private patient. Okay. Number 7, I want to talk about the beauty of just treat private patient. This is one of my advertising for my workshop in Hamilton in September. Number 8, click the link to the quiz. Okay, so that is tonight. Okay, number 1, I'm going to send you the link to sign in. Okay, again, do not copy and paste it again. Everyone just use this link. All right, and do not paste anything. You don't have to tell me you have done that. Okay, just be quiet, just click and do, because if you reply anything in there and then the people behind you, they actually look, do not copy and paste it again. Just click the link and copy the link into your browser and then sign in. Okay, I'll give you some time, because if you reply anything now and then those people behind you, they can't see the link. It's okay, not a problem. Thank you. All right. No, do not say anything. I'm not asking for anything. Do not type anything. Everyone just go and do that. Okay. You don't have to type anything. I see that 85 people sign in already. My system just update me straight away. I can see it. 90 person. Okay, I'll give you another minute for you guys to do it. So we have 100 and something people in here. Let's have a look. How many people do we have in here? So 152, right? So if you're not injured New Zealand practitioner, you don't have to do it. Okay, you don't have to do it. Right. Yeah, you don't have to tell me you have done it. Okay, if you can't do it, please copy to your computer, send yourself an email to your computer, and do it on a computer. Try a different browser. Okay, you can try Safari. I don't recommend Safari, to be honest. Sometimes it works, sometimes it doesn't. Try Google Chrome. Okay, Firefox, sometimes it works, sometimes it doesn't. So you just have to try. Okay, you can't do it, I can't help you. You just have to do it yourself. You just have to copy and paste, send you an email. Okay, don't need to let me know you done it. That's it. Okay, so that's it. We have 113. The rest of it, probably you are overseas practitioner, you don't need certificate. That's okay. We only provide to New Zealand acupuncturists. Okay, there's a lot of work, so hope everyone understand it. Okay, that's it. I'll post it again later on. Okay, for those a bit late in here, thank you. Right. Here you go. Gastroesophageal. Right. What is gastroesophageal reflux disease? Right. It acts short as GERD. R mean reflux, D mean disease, and gastroesophageal. We can, I normally just tell patient acid reflux. That's it. Okay, I don't see much. Okay, it's a digestive disorder that affects the ring of muscle between your esophagus and your stomach. Right. This ring is called the lower esophageal sphincter. I don't pronounce it well. Anyway, if you have it, you may get heartburn or acid indigestion. Okay, so most people will feel heartburn. right? Burning sensation in what is it, heart, in the chest area, okay, in the chest area, and acids come to the mouth, okay. So doctors think that some people may have it because of a conditions called high hernia, right? Maybe, but not all the time, okay. In most cases, you can ease your GERD symptoms through diet and lifestyle changes, but some people may need medication or surgery, right? Yeah, that's true. Um, the cause, okay, the term gastroesophageal refers to the stomach and esophagus. Reflux means to flow back or return. Gastroesophageal reflux is when what is in your stomach back up into your esophagus. Right. In normal digestions, your LES opens to allow food into your stomach, then it closes to stop food and acidic stomach juices from flowing back into your esophagus. So gastroesophageal reflux happens when the LES is weak or relaxes when it's shouldn't. This leads the stomach's contents flow up into the esophagus. So this is the cause, according to Western medicines. Okay. Well, we believe in it. I understand it. So you should understand it too. But what our job today is to figure out the symptoms. How does it relate to acupuncture meridian and the TCM 脏腑 organs, right? So we all see this type of patient, right? The people come in, they come for back pain. They say, "Oh, I have reflux." They sometimes they ask you, "Do you treat reflux? Do you treat acid reflux?" Burning chest pain that starts behind your breastbone, which is the chest, and moves upward to your neck and throat. So people will get throat sensation, burning in the throat, or discomfort in the throat. Now, for us, we want to know what meridian involved. So I put down here, it's called run meridian, kidney meridian, and stomach meridian. You see, but this area, okay, and up to here and up to here. Okay. So what is the meridian here? Run meridian. And the meridian is next to it is kidney meridian. And over here, that red one, this is stomach meridian, right? And people will get on here or the stomach. Normally, the discomfort or the heartburn more on here, and it could happen like discomfort may not be burning above the belly button. Very rare you see patient have discomfort or burning down to below belly button. If it's below belly button, that's not the problem in here. It normally go up from here, the stomach area, going up, okay? And it can up to here. So for us in acupuncture, for my method, that I want to know whether the sensation is in here, or is in here, or is in here, or along here. Everyone's different, okay? Why do I want to know this? Because in the acupuncture, when you choose the point, you want to be precise to get rid of the sensation. You want to get instant relief. You want to know where exactly the sensation is. Does it make sense? So this is what we call acupuncture 1. Right, many people say it feels like food is coming back into the mouth, leaving an acid or bitter taste. So the patient may feel bitter in the mouth or sour acids. Okay, the patient may feel nothing. They feel only heartburn. It doesn't actually come. There's nothing to come to the mouth. Okay, varies. Okay, beside pain like heartburn, you may also have nausea. So nausea, what organs related to it? Stomach, right? Bad breath, stomach. Trouble breathing, then the trouble breathing will be lung, right? A hard time swallowing. Swallowing is in the throat. The main areas in the throat, there will be run meridian and stomach meridian most of the time, okay? Vomiting. So vomiting is stomach organs, right? Alarm in your throat, the stomach and run meridian, okay? If you have acid reflux at night, you may also have lingering cough. So it means this patient, they lay down. Let me show you. For some patient, coughing very obvious. When they lay down at nighttime, they cough. If they stand up during the day, no coughing. Right? And mostly this cough, they have heartburn. But I do see patients, they don't have heartburn at all. They don't even know they have acid reflux issues. But when they sleep at nighttime, they lay down, they have to clear their throat and start to cough. And they have to stand up and walk around and they feel better and they go back and sleep and they're fine. And then wake them up again. So if you know, in the common cold, people get cough and they probably getting better. And then they say, oh, I'm coughing at nighttime, only at nighttime. Okay, those are because the end of the cold. A lot of things clear up already, but they sleep at night, they still have coughing. At nighttime, a bit colder. Okay, so this is different with the reflux one. The reflux one, they don't have any common cold symptom. They haven't suffered from any flu or virus or whatever. All right, no sign of common cold. They just lay down and cough, and it could happen for years. And one of the simple idea for them is they just put their bed a bit higher, the upper body one, higher pillow, or get the whole bed. Now they can buy a bed that can move, like in the hospital bed, like in the clinic we use those beds. Yeah, put it up and sleep, a sitting sleep, sitting position and sleep, or lazy boy, and they won't have this problem. And that's mostly you can diagnose that this coughing is caused from reflux. Okay, does it make sense? So do you get me? If you get me, please reply 1. Are you following? Simple, right? Thank you. Let's keep going. Right. Laryngitis, which is like an infection in the throat, right? This is lung because it's from lung organ in stomach and run meridian. Asthma that comes uncertainly and get worse, right? That could be just lung, right? Affecting the lung. Sleeping problem, that's heart pericardium. The reason I put on heart pericardium, that's because heart control sleeping, okay? 心长神, yeah, heart, relating to the sun, and pericardium as well. Okay. Are you guys following? Any questions so far? So what I'm talking about just now is just simple, you ask question and patient tell you what symptom, and you analyze those symptoms and find out the sick meridian and sick organs. That's it. That's what I did. Okay. So it's by asking question to find out those things. And can you do any other diagnosis to make any other way to make diagnosis? Yes, you can. Look at the tongue and look at what area come up with problem, and according to the tongue, and you make the organ diagnosis. Or you can take the pulse and make the organ diagnosis. Okay. And the way that I show you is just a simple way everyone can do it. Okay. So I don't show you the tongue, I don't show you the pulse. Okay. Does it make sense? So they can relate it to liver, kidney, whatever. There are many, but I just simply show you, more common thing, and people we can discuss today, and then we can all learn, and we can use today, tomorrow, or the next day, whatever. Does it make sense? Okay. Now it comes to the time that I should share with you the link again. So I'm going to copy the link and send it to those people who are a bit late. If you are New Zealand acupuncturist, here is your sign-in link. So that is your last chance to sign in to get your certificate. Okay. Remember, you need to sign in this, and you will receive a confirmation email, and then you also need to complete the quiz in the end of this webinar. You have done two things to be able to receive your certificate. Okay. Now go ahead, for those you haven't signed up. Okay. Let me have a look. Yep, we have 142 people sign in already. Although we have more than that on our platform tonight, which means some of the overseas acupuncturists, you don't need it, and we're not preparing for you. Okay, thank you. Let's keep going. Now, let's go for acupuncture 1, 2, 3. So acupuncture 1 basically is making a diagnosis. Making a diagnosis, right? Now, you see, in this chapter, I only make the diagnosis based on meridian. I don't make any diagnosis based on organs. Okay. So acupuncture 1, where is the discomfort for most what we discuss, the symptoms. So basically, normally it appears on above the belly button, 神穴, and you can see that in the middle, the meridian in the middle called Ren meridian, and the one next to Ren meridian called kidney meridian, and the one next to kidney meridian called stomach meridian. Most of the time, the heartburn will stay on what involved with these 3 meridians. Okay, these 3 meridians. Very rare that sensation as you go across to affect spleen meridian. Okay, very rare. It may, okay, I'm telling you, it may, but most of the time, no. just 3 meridian. That's it. Okay. Now, if your patient come in with heartburn involved with those 3 meridian, which we call 6 meridian, right? Then you need to know whether the the symptom is actually on the stomach area, which above the belly button, or is actually on the chest, or on the throat. Okay, this is very important. It could be from here up to here, up to here, right? It could be just in your throat, right? You need to ask the patient because it's so important. I'll let you know how important it is later on. Right. Any question for that? 6 meridian? If you have no question, please reply 1. Okay, thank you. Next one. Acupuncture 2. Now we are finding the balanced meridian. So we ask a question. We are doing distal point strategy for this patient. So we need to find out what balanced meridian that can treat those 2 meridians, those 3 meridians at the same time. Okay. Then we go to 6 systems. Now, in our class, we show you how to do this. Okay. This is acupuncture 2. Then we figured out large intestine. It can balance kidney meridian as well as stomach meridian. Okay. In large intestine, balance kidney meridian that's through system 4. System 4. And large intestine can balance stomach meridian that is system 1. And we also find that pericardium meridians can balance kidney meridian, and that's system that's system 4. System 5, sorry, system 5. Pericardium can balance stomach meridian, that is system 2. And pericardium also can balance run meridian. So as you can see, if I combine those 2 meridians and treat those 2 meridians at the same time, I actually treat all 3 6 meridian, which including run, kidney, and stomach meridian. Right? Right. Are you following? If you are, please reply 2. Very simple, right? Although I didn't show you those 6 systems, but this is how we get to it, step by step. 6 meridian first, and then find out the balanced meridian, and then we go to acupuncture point. Yeah, Natalie, this is because I didn't actually show you those 6 systems. All right, you can attend my workshop, then we can show you, or you can go online and find out those 6 systems. Today is a quick one. If I need to show you a lot of job, so I want to give you the answer, but I tell you that this is the step. Okay. Cool. Where you from, Natalie? Is it in New Zealand or in other country? No, you didn't miss it. Wellington, very close to Hamilton. Okay, cool. Next. Okay. This is choosing the point. So we choose the point based on holographic theory, holographic image. So look at the left image first. There are two images in front of you. Look at the left one. The left one, as you can see, I got one leg and one hand beside the trunk, beside the body, right? And look at the body right now. I pointed over here, belly button, right? 肚脐, L2. And that's same level as knee joint and elbow joint. And I also pointed out the neck is same level as hip joint and shoulder joint. So what it means, the hip and shoulder treat neck, the knee and elbow treat anything that on the same level of belly button navel. Then the thigh and the upper arm, it can treat anything from belly button to the neck, which is just chest and upper abdominal. Okay, now go ahead and look at the second image, which is on the right side. Now, this is called reverse image. You see that the legs now, the toes pointing to the top and the fingers pointing to the top as well. That what has changed? It changed to the ankle and the wrist joint. Now they can treat the neck area. And the knee and the elbow joints, both of them can treat the level of umbilical, which is navel. Okay. And you find it, okay, either in the image we just discussed on the left side and the image we are discussing right now, doesn't matter the legs or hands, the position of them, how they point to, where they point to, and you find out that the knee and elbow joints are always connect or balance to the belly, umbilical. Okay, this you need to have an understanding of this. And now look at that on the right image. Between the ankle joint and the knee joint, this part we call lower leg. And lower leg now can treat chest and upper abdominal. And the part we call forearm. Forearm is between wrist joint and elbow joint. And this forearm now can also treat chest and upper abdominal. Right. Now, Shelly, all this link is actually working because I can see that all people have signed in. I have actually 150 people sign in already. If it doesn't work for you, please copy and send yourself an email and go to your computer and click it, or again copy the link and paste it on different use another a different internet browser to open it. Okay, if you copy, you have to be careful. Yeah, click the submit. When you fill in, you have to click the submit. Okay. All right. Do you guys get me in this part? I'm actually showing you the image. The image is very important. That's where you get to the point. Right. So we just showing you that But the sensation could be in here. And where do you get the point? Sensation could be in here. Where do you get the point? Sensation can be in here. Where do you get the point? Right? If you're using forearm and forelegs, right? When I'm doing this, right? You see. Can you see me? Okay. Here's what you see. You see, this is the belly button. This is the neck. If the sensation, burning sensation is in here, I'm going to choose point on my wrist, around the wrist. If the sensation is between here and here, upper abdominal, how do I choose the point? Simple. Neck, belly button, halfway. I'm going to treat halfway here, right? So this is neck, belly button, halfway. I'm going to choose the point over here. Are you following? If you are, please reply 3. If it's on the chest, between here and here, this is the chest area, a burning sensation in here. How do I choose the point? Simple. Neck, belly button, halfway. You see, over here. I'm not talking about meridian moment. I'm talking about the area that you should choose the point, the acupuncture point. Right. This is in here. So now we cover from here to here. We know from elbow to wrist, we can treat acid reflux symptoms. But what about when we come to the leg? Simple. Knee, ankle, right? If it's in your belly button, again, I'm going to treat knee. If it's anything on my neck, I'm going to treat the elbow, choose the elbow point. Again, I'm not sure what meridian yet. Okay, we're going to combine acupuncture tool later on. What if it's just an upper stomach, upper abdominal? You know, well, from here to here, halfway on this area. Then from here, this is the neck, this is the belly button, halfway. You're going to choose the point over here. From here to here, right? All this area. What about on the chest? Wow. Here to here, halfway. To belly button is halfway. Halfway. Over here. Doesn't make sense. On the leg, lower leg. Right? You can do upper leg, thigh. You can do upper arm. But I'm make it easy. Let's just do the point below knee and elbow. What? Does that make sense? Are you following? If you are, please reply 4. Yes. You guys can get this. I'm going to do it onto a PDF, and it will be on my platform, Height platform. Okay. So you can download from there, or you can do a screenshot. Okay, you can do a screenshot if you wanted to, but I'll give it to you all this material. Okay. Okay, let's go to the next one. What you can see over here, this is acupuncture 3. We're choosing the point. I'm going to show you local balance. If you look at the large intestine, we have large intestine 5 to 12, right? If you look at the pericardium 3 to 7, right? Now I'm choosing pericardium 6 and large intestine 6, okay? 偏力和内关. So I'm choosing one point over here and one point over here. They're quite similar, right? What do they treat? They treat mostly chest, right? Do you get me? Very simple. So you can Oh, because most of the heartburn isn't here. Most of the heartburn, the reason they call heartburn because it's in the chest. Right? But you do get some people, they don't have the chest in here, they just feel discomfort in here. Not even heartburn when they come to you. It's not burning, but it's just discomfort in the tummy over here. Then where do you choose the point? Over here. Okay? Right. Now, okay. I also list out the points on for stomach, from stomach 35 to stomach 41, and kidney 3 to kidney 10. And I'm choosing stomach 36 and kidney 7. The reason I do this because I'm going to show you the global balance. Okay, global balance strategy. It is now those 3 sick meridian, you can simply choose PC6 and large intestine 6, and that are good to get rid of the sensation, to reduce the sensation immediately. Okay. Okay. This one I call KP Yangming, which is one of the 12 patterns, global balance patterns. In this KP Yangming, K means kidney, P means pericardium, Yangming, foot Yangming, stomach meridian, hand Yangming, large intestine meridian. It also called Dr. Tan's magical 4 meridians. If you search it on Google, you see all those things. Okay. The main thing is how do you choose the point? Okay, I suggest PC6 on the right hand, kidney 7 on the left leg, and then large intestine 6 on the left hand, and stomach 36 on the right leg. And again, you can swap left side to a right side to a left side. What I mean is PC6 swap it with large intestine 6. Stomach 36 swap side with kidney 7. Okay. Now, do you get me? Do you understand the point? You see, I choose the point all around here, right? In this area, it's mainly for here. Now, I choose one point over here, which is stomach 36, right? And that can treat chest pain. That can treat over here, this problem over here too. Okay. Now, I'll tell you what, if you're not quite sure how to choose the point, just place those 4 points on your patient. What happens is when you do those 4 points together, okay, it become a global balance. Right? It connect 4 meridian together, and it's very strong. And sometimes it doesn't. You don't even need to match the point. Use the image to go to the chest. What I mean is those 4 meridian, you just simply choose either point on those 4 meridian. It can work, but of course, it work even better if you choose the point that match the symptom, the level of the symptom. Does that make sense? If it does, please, if you understand me, please reply 5. Yep, definitely PC and stomach in the same side. This is global balance. Thank you. Okay. You see in this page, It includes the sick meridian. The sick meridian we call as stomach meridian and kidney meridian, right? So we treat stomach and kidney meridian and global balance. We treat the sick meridian. We also add on two balance meridian, which is PC and large intestine, right? Then you see, but we haven't treated the run meridian in this case, right? But it will still work because pericardium can balance run meridian. If you do pericardium and it works, the symptoms are gone, no burning sensation, that's good. You don't have to do anything. But if the patient said, well, it reduced, pretty good now, but this can still feel a little bit. It's better, but still a little bit. And then you need to go precise. You ask, where exactly is the discomfort, the burning? And it may show you over here in the middle. And you need to ask them to use one finger to show you. If they show you that it's still in here, and then you don't know, oh, still 3 meridian, right? If you say, oh, can you use your one finger to show me? And they may show you in here, but when they use one finger, it's in here. Oh, no, okay, this is run meridian. And what do? Go to 2 meridian from here to, I can't remember, I call Szenan in here. I don't know there's 2 whatever to 220, and then you got to go to here and to 220 and get the ulcer point, get the painful spot, and place a needle. If you find 4 needles. If you find 1, just 1 needle, and that can get rid of here straight away. Okay. Again, if you do KP Yangming, everything's gone. You don't have to add any needle in here. If you do KP Yangming in here, those 4 points, and the patient says, I still have some sensation, and you find it's on the run meridian, then go to 2 meridian from 17 to K 220 and get the ulcer point and place needle here. Okay, and that will get rid of the heartburn. 224. Thank you, Natalie. Right. Are you following so far? If you are, please reply 6. Simple, right? It's not hard at all. We use it all the time. It works. Okay, this is one strategy. Remember when I talk about here, this is acupuncture 1. Sometimes it involves breathing problem. Trouble breathing, that's lung. Okay? Then when it involves lung, and the strategy what we're doing in here, it may not work well because they can't treat lung. Maybe the last intestine can treat lung, but there is better global balance for it, which we call tie-in Yangming. And tie-in Yangming, you see that we treat large intestine, right? But we don't treat kidney meridian. But we treat stomach meridian. We don't treat kidney. We don't treat the run meridian. Right? In this one, it works well too. Okay, it works well too. As you can see that stomach, we use stomach 36. Lung, we use lung 6. Large intestine, I use large intestine 10. Spleen, I use spleen 6. If the patient have breathing problem, coughing, then add on this pattern. So you can combine this pattern and the last pattern together. When you combine together, the stomach meridian is the same point as well. And over here, you needle PC6, as well as on the right hand, as well as lung 6. In large intestine, you can needle large intestine 6 or large intestine 10 or 2-point needle at the same time. And on kidney 7, you can needle kidney 7 as well as spleen 6 together. Okay? That's another strategy when the patient have coughing and they have breathing issues, add on this tie-in Yang-Ming pattern will work better. Okay, but your first choice is always KP Yang-Ming. Okay. Right. You're following. So which one is your first choice? You will type it in, tie-in Yang-Ming or KP Yang-Ming. Your first choice. Most of the time, which one is your first choice? KP Yang-Ming. If you go for KP Yang-Ming, it's always right. And it can also treat the lung as well because there is large intestine in there. But it may not be strong enough to treat the coughing and the difficult breathing. But anyway, coughing and difficult breathing, it doesn't happen to everyone. Okay, most cases just burning sensation in here. Okay, now we're talking more about acupuncture strategy. Look, let me ask you a question. Okay, does acupuncture work 100%? The two strategies I show you today, do they work 100%? I mean, 10 out of 10 or 100 out of 100, everyone come or get brilliant results. That's it. I can heal them 100%. What do you think? Can you get acupuncture to heal all the heartburn patient? No. You don't have to be shy. Just be honest. But not. No. Yeah. Do I fail by applying those? Yes. I do fail by applying those sometimes. Then the question is, you need to find out the next strategy. But most of the time, this strategy works brilliant. No problem. Okay? So I'll be very honest to you. It was about, before I went to Taiwan, I have a case that I signed up with 3 acupuncture, very severe one, that normally patients lying down, they feel they get coughing. But this one, from here, from the tummy up to chest, up to here, discomfort heat. So you can feel all the time, 24 hours, and then sometimes coughing, even standing up coughing. And we did acupuncture, 3 times. The results, not too well. When I say not too well, I say, well, is it better? I said, better in what way? I said, I don't wake up at nighttime and cough anymore, but I still feel the discomfort all the time. So when I put needle in, I told her, most of the time I put needle in, the patient feel fantastic. They can't feel anything at all for most of my case, but not for you. When I put needle in, she can still feel it. It went away, it came back again. It went away, it came back again. Very quick. Very quick. Laying there for 15 minutes, 20 minutes. The sensation goes back. For my other patient, I put needle in, it's gone. They're comfortably laying there for 15, 20 minutes and needle out, they still feel better. But this is the case that I find it didn't work. It didn't respond very well. And what do I do? So what would you do when it doesn't work well? So it's funny that I show you some point and I talk about the case that I failed, right? It's not very good, right? But this is the reality. The reality, if I tell you it works 100%, I'm lying to you. Okay? So reality, it worked for most of the case, but you always find no matter how good you are, there always 1 or 2 or 3 cases doesn't work well, doesn't respond well. So be honest to the patient and say, well, in the re-examination, I say, now the acupuncture is working, but not very well. We need to add on herbs, right? So now I need to see you 2 acupuncture weekly plus herbs. And the patient look at the price, that is too much. I said, that's okay. You can either go for herbs or acupuncture. And the patient choose herbs. I said, that's good. We try herbs and we see how it goes. Before the patient left, I took the pulse and I go to the herbal room and then I make the tea for the patient. I said, drink it and see how you feel. So after acupuncture, patient sit there and we talk and then she drink. I said, this is good. When I drink it, I can feel that it went away. And if we want to come out, I drink another, I sip another mouthful and I drink it down and it went away again. So he said, this is good. I said, that's good. Let's just use herbs then. So we run a test. So I always go and run the test. I tell my patient, this is what we're going to do. I think it's going to work for you. I'm pretty comfortable and confident, but sometimes I can't predict the results. So when it doesn't work well, I'll change the strategy. So be honest to your patient. Right. Are you following? If you're following, please reply yes. Why? That's good. Thank you. Thanks. Now, my next question is, does structure imbalance interfere organs? Today, we're talking about stomach mainly, organ function or stomach function. If it does, please, if you think it does, reply why, or if it doesn't, please reply no, and. Yes, it does. Then my next question for you, do you have any strategy to help with your patient's structure imbalance? Yeah, most of you say yes, right? What is the strategy? What acupuncture, or do you do tuina massage? You do chiropractor work, osteopath work, 整骨 to correct the structure. Now, we all agree in here. I haven't seen anyone reply no. Okay, we all agree that the structure imbalance does interfere with organs. Then with the acid reflux, the structure imbalance would actually interfere and make the stomach organs out of balance too. So how do we look after that? The strategy that I show you, it was looking after treating the organs imbalance and the meridian blockage. We have nothing to do with the structure. So look at this picture I showed you last time. If the patient's shoulder, one shoulder is higher than the others, that means that is structural imbalance, right? And how do we treat that? Can we use needle? Now, my question for you, can we use needles? Okay, simple idea for you. Yes, we can. With the strategy I show you, if you needle an in meridian, we're talking about leg, okay? We're talking about leg, okay? If the shoulder is higher on this side, then on that leg, you're going to needle in meridian. Right. If the shoulder here is lower, then on that leg, we're not talking about hand, leg, you needle yang meridian. Once you needle, the shoulder is higher in meridian and here, then you know the opposite hand, you needle in meridian as well. And once you needle yang meridian in this leg, and the opposite hand, you needle yang meridian. Does it make sense? Do you get me? So you are using distal point to correct the structure imbalance. So when you apply that, you find that the result will last longer if you follow this pattern. Do you get me? Okay, that's it. Do you all get me? Do you understand that? Well, if the shoulder is higher in here, if you needle in meridian, you should needle on here. But if you needle in here, you still get results. But your result is based on balancing the meridian and the organs, but you're not balancing the structure. But if you needle, the shoulder is higher in here, if you needle in meridian in here, you are balancing the meridian as well as organs, as well as structure. Okay? So this is what you do. Okay? Yep, Natalie, your conclusion is right. Totally right. Okay. If you want to get the structure even better, then you do some technique on those points to get jumping sensation or to get some dirty sensation. It will work even better. Okay, but not everyone can handle that strong sensation. It doesn't need to be strong. And again, what length of needle do you use? I normally use 40 mm times 0.2 mm, very thin needles. Now I can use, if I do technique on those points, if I don't lift needle, I don't normally lift needle on there. With this technique, I use only 15 mm of needle and just quick needle in there and out, quick needle in there and out. But you may not have the technique in there, and I'll show this technique in my workshop. It's easy. For you, lift the needle for at least 15 or half an hour. It will work better. You can leave it for longer. It's up to you. Okay, question. How many patients do you see a day? We'll discuss all this question with you today. How many patients do you see a day? Don't be shy. Let's discuss it. 9. Thank you. 6 to 10. Awesome. 5. Awesome. Thank you. 6 to 7. Thank you. 5. Thank you. 7. If busy, 9 to 11. Awesome. What about the others? 5 to 9. Awesome. Thank you for sharing. Let's open up, you know. Now, next question. Do you treat private patient in your clinic? And how many a day? We all treat ACC patient, right? I know, but what is the portion of the private patient a day? So if we're seeing 5 patients and 2 patients will be is private, or 9 patients, 2 patients will be. Natalia, almost all private patient. That's good. 2 or 3. Yeah, almost all ACC. Thank you. 1 ACC private patient. Thank you. Most patients under ACC. That's good. Or 0 to 1. So 2 to 3 non-ACC. Okay, 2 to 3 non-ACC. That's good. Thank you. Almost ACC. Yeah. Cool. Glad to see that. Thank you. Okay. Now, can you put up the numbers? The ACC patient numbers vs private patient numbers in a day, approximately. I'm just trying to, I don't need your answer actually, but I want you to write it down to answer yourself, because I'm going to ask you some questions. You need to find out what you want. Okay. Okay. 6-2. Thank you, Anna. Okay. Cool. Thank you. Thank you. Hey, thank you for your typing, all right, for your answering. I know a lot of people don't want to join in, but for those who are joining in, I appreciate that. Good, Chelsea. 6 private, ACC 3. Awesome. My next question is, how many patients do you want to see in a day? You're comfortable to see. What is your number? 6, 7, 5? Yeah. There is no wrong or right. There's no wrong or right. Okay. 11 plus. Thank you. 5. Thank you. 5. Okay. So, I mean, in a day, it's about 8 hours. How many patients do you want to see a day? 8 hours. Okay. Let me share with you. I just been to Taiwan. Um, do you know how many patients? 16. Good. How many patients Taiwanese acupuncture will see in 4 hours? In 4 hours. Do you have any idea? 20 plus? 50 to 60. 50 to 60. Yep, it's about 50. Okay. Then you ask yourself, do you want to see 50 or 60 patients in 4 hours? I ask myself, can I do that? I don't want to do that. I can do it, but I don't want to do it. And why? Is illegal here? There's nothing illegal here. You can see more patients. I see up to 8 patients an hour. There's nothing illegal in here. You can see more patients, of course. What's illegal about? I see up to 8 patients an hour. Nothing illegal here. The thing is, if you see 5 minutes, 1 patient in 5 minutes, there's 6 patients an hour. Or 12 patients an hour it will be 4 hours will be 60 patients. The quality of patient. I don't have time to talk to my patient. I don't have time to guide my patient to do the right thing, because lifestyle is very important, in especially in this cases, high reflux, right? You need to talk to patient what to eat, and the patient say, well, oh, it was so good for the last few weeks with acupuncture, and suddenly it came back very bad. And then you need to spend time. What do you eat? Is there anything happen in your life? Emotional, because emotional can cause that too. Anxiety can cause it too. Okay, this is myself. I won't be comfortable to seeing 5 patients. I can, but I don't have enough bait. That's another thing. But I myself, I did see 8 patients in an hour. Then I can do that because we examination half an hour for patient, come and just talk, do a examination. So I can make sure the quality, but it's still too fast for me. I can't make sure the quality in the treatment. So I may not, unless I find a way that I can make sure that the quality treatment for patient, and I'll be able to do that. Okay, so there's no wrong or right. Okay, we all have our reason, and that's okay. 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 Let me ask you, what diseases can acupuncture treat? And what diseases can Chinese medicine treat? What can we help with patient with acupuncture? And today we're talking about acid reflux, right? And last time we talked about anxiety. The time before we talked about tinnitus. And does ACC cover tinnitus, anxiety, and acid reflux? No, most of the case, no. It may, if there's a sensitive case of anxiety, they may cover it. But my patient went to ACC and asked for it, never get the claim. Yeah. So ACC mainly cover injury, right? Then the question is, if as an acupuncturist we can use acupuncture to treat anxiety, tinnitus, and acid reflux, and much more, why are we just focusing, most of us, ACC patient? No, same here. Me neither, Natalie. Never been able to get sensitive case through ACC. Yeah, the patient going there, I told them, waste of time. I said, don't do it. Just waste of time, make you more miserable. They want to do it, and they go and do it, and none of them been approved. There's no evidence. They say there's no evidence. Even the patient feel good with the acupuncture. They say there's no evidence. Okay, maybe we have to talk to Kate. I never did that. Okay, but anyway, the reason I asked this is because I'm doing this free webinar and free CPD. I have 2 reasons. Okay, number 1 reason is because most of us just doing ACC patient pain relief, and see acupuncture deal with pain relief, chiropractor, osteopath, physiotherapy. Those are dealing with ACC, right? Massage therapies, massage therapy, non-ACC related, they're treating pain relief patient too, right? Then, of course, pain relief patient, you see more common. But look, acupuncture can help infertility cases and acid reflux, and mental health, anxiety, depression, and we see indigestion problem, tinnitus. Tinnitus is a good way. No one can help tinnitus in here. Have you seen anyone say that they've been to anyone and then said that tinnitus has been fixed? No. And acupuncture is good. That's why I do tinnitus to share with you the technique. There's no cure for tinnitus. And some people driving crazy, and some people even suicide because of tinnitus. My patient comes in, I want to kill myself. That's how bad it is. Acupuncture can. But do you have a way to get acupuncture works 90% of the time? Yeah, 90% of the time, if you can get 90% of the time, get result for tinnitus. I'm not saying cure. I'm not saying fix. If you can get results, they come to you. Okay. Now, how do you get private patient? My question, this is very important. For most of you, you're doing ACC patient. How do you get private patient? So I want to encourage you guys treat more private patient. Because if you're just dealing with ACC patient, that's okay. That's your choice. But for me, is acupuncture can do more than pain relief. Why don't I do that? And I ask myself, why don't I do that? Is it because I don't have private patient? Is it because I can't treat it? I don't have the ability. I don't have the skill. Or is it because I don't know how to find the private patient? Word of mouth, advertising. Yep, advertising, word of mouth. Advertising, you need to spend money. Are you willing to spend the money? A simple way I want to share with you, if you're treating ACC patient, it's all about conversation. How do you talk to your patient? Your patient comes, you fill in a form, or you ask them, do you have this, and you tell them, hey, I can help with tinnitus. Let's try it. You see? Put a few free needles for them. If it works, tinnitus doesn't cover. This is not covered under ACC. Does not cover under ACC. When your back pain's better, if you want to continue the tinnitus treatment, you have to pay privately. Are you happy to pay privately for tinnitus treatment? That's how you turn ACC patient to private patient. Does that make sense? This is one of the way we get private patient. Yep, agree. So, but the question is, for those of you, if you do it only ACC patient, why don't you try this way? Ask your patient for other problem. Do they want help? Either yes or no. Yes, go for it. No, that's okay. When the ACC claim back pain finished, they go. Let them go. You go to McDonald's, they ask you, do you want at $1 and get an ice cream? They simply just ask. If they say no, thank you, they give you your food. If you say yes, please, add on $1 and get and ice cream. How do they know that you want ice cream or not? They ask. Does it make sense? Okay, we're going fast now. Do you want to know how many patients I treat a day? Question, do you want to know how many patients I treat a day? Don't just guess. I'm asking, do you want to know? Don't just guess. Do you want to know? Yes or no? Yes, okay. Thank you for replying. Right, let's go to back to here. This is on Tuesday when I make this, and I Tuesday in 18th. Okay, I start at 11:30. I don't work full days. Okay, so every 15 minutes I see one patient. That's because our system only allow us to do 15. That's one of the reason. Second reason, because we only have 7 beds in our clinic. Okay, and I share with other practitioners. As you can see on the left side, on the top, Tuesday, 18/7, 2023, Tuesday, that's Szenan-Balance, and that's my calendar. And you see every 15 minutes, 11:30, I have 2 patients in there, 11:45, non-patient, 12, 1 patient, 12:15, 1 patient, and between 12:30 and 1 o'clock, we have team meeting in the clinic. In 1 o'clock, I have 1 patient. 1:15, I should have a patient, but cancel, that's okay. 1:30, I have another patient. 1:45, another patient. 2 o'clock, another patient. 2:15, another patient. 2:30, another patient. 2:45, another. There's no patient at 2:45, but 3 o'clock. Okay, and then 3:15, I should have 1 patient, but cancel. That's okay. 3:15, I have another patient. 3:30, 3:45, 2 patients in there, and 4:15, 1 patient. So if I take off the half an hour, so I probably work 4 hours in this day, and I'm seeing 17 patients. Or seeing 17 patients. If I add on those 2 patients, I'm seeing 19 patients. So that's my case. Okay, I can see more, but we don't have enough room anymore. Look at my colleague on Tuesday. Now the blue one means private patient, and I don't see any ACC patient at all. In my case, I don't see any ACC patient at all. Before COVID, I see ACC patient. My surcharge is $80, and I do see ACC patient previously. Okay, I did, but now no, I don't see any ACC patient. Okay, so I refer my ACC patient to my colleague. So the second one over here, this is my one. So this is the second one. Seeing 14 patients start from 10:30 to I think 7 o'clock, and cross over ACC patient as well. So when we cross over ACC patient, we don't charge ACC 60 minutes. We charge ACC 30 minutes. And the surcharge is $45. Okay, and you can see that here only 5 ACC patients, sorry, and the middle one, Kenny. And Kevin only without less than 6 months, and she is working part-time from 1 o'clock to 6 o'clock, is seeing mostly ACC patient and 2 private patients, as you can see, blue one. 8 patients from 1 o'clock to 6 o'clock. That's how many hours? 6 hours. Okay. I don't have assistant, but I do have assistant. The assistant means front desk. They book the patient, they bring in the patient to the bed, and I carry on with the rest of it, putting needle, keep the notes, take out the needles. That's all my job. Now, I leave the patient. So you see, when I treat patient, I use my technique. Very quick technique. Okay, I do quick acupuncture as well. Quick acupuncture within 10 minutes. Those patients come in, needle, go out. That's it. 15 minutes, done. Okay, for the whole treatment, we book an hour, but I can finish in 45 minutes. The process is the patient come in, I treat it with quick acupuncture, which I'm going to teach in, coming out in September. The quick acupuncture, you don't have to lift the needle. You can lift the needle if you wanted to. So within about 5 to 10 minutes, I did the quick needles, which for the structure, and I take the pose and insert needle, lift the needle for 15 minutes, and then take out the needles. So sometimes half an hour to 45 minutes. So aim for 45 minutes or 40 minutes to get everything done with one patient. Okay. Okay. So I'm showing you my ability to treat the patient, and I want to encourage you. You can treat private patient, and you can acupuncture can do more than just pain relief. Okay. And how do you get all this private patient? There's a way. Apart from asking your patient, ACC patient, there's a lot of things that you can do. And I'm wanting to share with you in my workshop. I talk about this. I share about this, the idea. So this workshop is in New Zealand is mainly for New Zealand acupuncturists. And after the workshop, you can come into my clinic and just follow me around and see how I finish, do the treatment for my patient, how we do the marketing, how do we answer the phone, everything. How do we talk to the patient, make sure they're happy. Okay. Now, we ran out of time. I'm not going to talk too much in here. I'm going to show you the next thing. So what do you need to learn or have to treat more patients? Okay. Number one, I think effective acupuncture techniques. When I say effective, you put needle in, you know what you're doing, you know you can deliver the results. Okay. And you're not waiting for half an hour or 10 or an hour to get the results, or the results come the next day. You want instant relief, and you want a way to perform it very quick. When I say quick, like in Taiwan, a student told me that since they learn my technique, they double the amount of the patient. So they can deal with 60 patients in 4 hours. That's how quick the technique can be. But they make sure they have results. Of course, they can't talk too much with the patient, but they deliver the results. That's the main thing patient want. They don't show care about the lifestyle thing. They want to do just acupuncture results. But for us in here, private patient, I charge $120. I can't just do quick 5 minutes or a few minutes in and out. It doesn't make sense for my patient. I want them to get really well. Okay. So you have to quick acupuncture technique and very effective acupuncture technique and skill. You don't have to learn from me, but you can learn from any other people. You make sure you do the needle, you get the result straight away, and then you can perform it very quick in 5 minutes or 10 minutes. You can finish all the work and leave the patient there and do the next one. And what you need to do, you time yourself. When you go to see your patient, you time yourself. You're going in at 5 o'clock. What time do you come out? Right? Then the third thing I think is important is marketing. There are many ways. You find it and you test it. You keep the one it works. The one it doesn't work, let go and keep trying. We have our own way to do the marketing. I don't mind to share with you, but this is only for if you're attending my class. Okay, this is my class in Hamilton workshop. Date is from the 8th to the 10th, September, Friday to Sunday. The time is 8 o'clock, 8:30 to 5:30. Okay. And we provide vegan lunch. And the venue is in Hamilton, Ibis Tanui, Hamilton. Okay. The class will be only in English. If you want to sign in, be quick because this is the last early bird. Okay. The full price will be 2141 New Zealand dollars, including GST, and the early bird before 28th of July will be 1982.30 cents. Okay. And after 28th of July, it'll up to 2141 New Zealand dollars. If you're from overseas, the 1349. Okay. Right. Well, again, the reason I share with you all this, I said that I want to encourage, you see all my topic, none of them related to ACC. I think none of them related to ACC. I'm going to do that next year. And every year I'm going to do probably 5 topics for free for everyone. Next year I'm going to do the same. And I'm encouraging everyone to treat a private patient because this is the way to get acupuncture name to everyone. Because most people, now they know acupuncture, they know acupuncture is good for pain relief, but they don't know acupuncture can treat other things. Okay. And we are trying very hard on our website, on our platform, Facebook, Instagram. You try to do video, do content. We hire people to do it. And we have a way that has been working for us. And I'm happy to share with you if you join my class. Okay. And the second reason that I actually do this 5 topics with everyone is because I want to promote my class. Okay. Be very, very clear with you. Okay. First, I want to encourage you to treat more disease private patient. Second, because I want to promote my workshop. That's why I do this 5 workshop webinar with you. Okay. Okay. This is the quiz, last part. We do it all together, and next thing I will send to you the link. Okay, and you have to sign up today. Finish everything today. If you sign up tomorrow morning, and the report run, and we won't run the report for tomorrow morning, only tonight. Okay. Okay. Question 1: KP Yangming, which is kidney pericardium Yangming pattern, including kidney meridian, pericardium meridian, stomach meridian, and large intestine meridian. A or B? A is true, B is false. We do it all together. You don't have to write it down. If you want to write down, it's okay. I'm going to show you the answer later on. True. Thank you. It's A, right? A. A, true. Thank you. Okay. Second, I'll give you the answer later on, okay? In color. Number 2, tie-in Yangming patterns is including lung meridian, spleen meridian, stomach meridian, and small intestine meridian. A or B? A, true, B, false. B. Yeah, why is that? Because it's including large intestine meridian instead of small intestine meridian, right? Let's go quickly to number 3. Tie-in Yangming pattern is including lung meridian, spleen meridian, stomach meridian, and large intestine meridian. True, A. B, false. Number 3, true. Yep. So it's including the large intestine meridian. Okay. Number 4, find answer point on KP Yangming pattern and tie-in Yangming pattern would get better result in treating acid reflux. A true, B false. True. Okay. Yeah. Even though I show you the point, but if you find the answer point, it will work better. Definitely. Okay. Definitely. If you can't find any answer point, don't worry. Just needle the point that I show you. Okay. That is the key to get the results. Right. Number 5, use 2 scalp to balance sick meridian, which is run meridian, all the time, as pericardium meridian does not work well for sick run meridian. A true, B false. No, it should be B, false. Why is that? If you don't have to use 2 meridian to treat run meridian. Yes, 2 meridian can treat run meridian, sick meridian, but pericardium meridian can work for run meridian very well. If pericardium work very well, you don't have to needle 2 meridian. If you wanted to, it's up to you. But in the theory, you don't need to. You just work on the KP Yangming pericardium. If it worked well for the run meridian, you don't need to add any more needle on 2 scalp to balance the run meridian. Okay? So this is a bit confusing, right? The answer is B. Right now, next, you need to take a picture of this. This is all the answer. This is the answer. Okay? Now is the time to get the answer to fill in the form. So for now on, I give you about 2 to 3 minutes, 2 to 3 minutes, then to fill in the form, the quiz. Okay? So do not reply anything. Okay? 2 or 3 minutes. Just go and do that. Key in your email and then submit and put all the answer in and then submit again. You will receive a confirmation email. It may be in your junk mailbox. Okay, check it. When you receive it, you are safe. You need to tonight webinar. If you need a CPD certificate, you need to receive sign in confirmation email as well as quiz done confirmation email. Okay, please don't give me your email. You don't have to place anything. Do not type in anything for me. Okay, I'm going to post it to you. So for those people who want to join my class, email me. Okay, I didn't actually post the link today. Email us. Okay, all right, here is the link. Do not post anything. Stop typing. Here is the link. Because if you type things on the chat box and people can't see the link, and do not copy the link and paste it again. Just use this link. Just use the link quietly and complete the quiz. Thank you. We have 153 people sign in tonight, and we have coming in. We have 5 people done the quiz. 6. Make sure your name and your email address is right. That's it. 2 things. Okay, very quick. We have 110 people done the quiz. I'm waiting for you guys hit to 154. Okay, you don't have to tell me you have done it. Okay, don't post anything on the chat box because people still want to use the link. Okay, thank you. So there's the link. We've done it. The next part is question. Any question for today? With one more, we have the webinar next week too, next Saturday. Okay. Thanks, Dion. Any question for tonight's topic? Okay, I see that 149 people sign up. That's good. I'm going to post to you a Chinese video in here. This is my platform on YouTube. You can follow my Chinese platform. I post a lot of valuable content on my YouTube. This is Chinese one. If you're Chinese, you can follow this. I'm going to post English one to you, and you can follow it. I actually put a lot of free content on my YouTube channel. Let me show you. Most of the time, the Chinese and the English content will be similar, but sometimes it does a bit different too. Okay, here is the one for English platform. If you want to follow my English YouTube, you can follow this one. You can click it and subscribe to my channel. And there are a lot of free content in there. It's pretty useful. Okay, for the rest of you, if you have no question, you can actually opt out now. Once you finish the quiz link, you can opt out. No problem at all. We have 153 people, 54. Yeah, one people hasn't done the quiz link yet. You're welcome. I'll see you next week. No question at all? Thanks, Ricky. Question, yep. Come with question, Aaron. What is your question? Yes, it's question time. I'm waiting for question. It seems like no one have any question. You guys are so smart. And probably I'm presenting very well in my topic, so no one has any question. There will be, I'm thinking this would be helpful for nausea too. Yep, absolutely. Absolutely. KP Yangming is very good for nausea. It's actually anything in here good for heart disease, palpitation, and chest pain, especially chest pain. Palpitation, we needle it, it may not stop the palpitation straight away. You need to do more needle. Normally at 5 palpitations, you need to do more needles for that, adding on the worm meridian. But for chest pain, fantastic one. And especially the needle on kidney meridian, you change to kidney 1. More painful. But I show you how to needle kidney 1 in my class. Thanks, Song. You subscribe to my YouTube channel. Okay, thank you. Thank you for supporting. Okay, it seems like no question at all, eh? That's it. Thanks, Aaron. Thanks, Jen Wen. Right. Have a good night. Have a good weekend, everyone. And hopefully see you all next Saturday. Well, stay awesome. Cheers. That's it for tonight. Bye-bye. Seems like no question at all. Thank you very much. I'm going to stop and log out all participants. Okay? Thank you.